And so today we are announcing specific actions to address pressures in acute care and in continuing care, including the opening of new continuing care spaces in Calgary and in Edmonton. We are reallocating. We are going to reallocate existing resources to make nearly 500 existing beds available over the next year, as well as by redesignating $60 million from ASLI funding, which is currently budgeted to tackle more of this challenge by reallocating those dollars. AHS will be directed to pursue other measures to allow for more efficient patient flow in our hospitals. That includes admissions and emergency departments, trying to achieve better outcomes by directing people to more appropriate care options and getting them through emergency more quickly, establishing home care and mental health rapid response teams, and greater use as well of urgent specialty care clinics and restorative home care as well. These initiatives, I would emphasize, are in addition to those initiatives that are already underway. Alberta Health is currently working with a number of continuing care providers on the completion of a number of ASLI projects, which have been funded over the past 4 years. As you know, this is a successful program. More than 1,400 additional continuing care spaces will be opened between now and the 2017-2018 year.
And I met with Vicki Kaminsky, the president of Alberta Health Services, and tried to find ways in which to put together a package which would work. We discovered there was over 700 people that were still residing, as the Premier said, in acute care, which should be in long-term care. Let's be fair, the reality is those people need to be in the kind of care they should have, because it's a much more in-depth and I think creative care when they're in the long-term situation rather than acute care. In the end, we hope that over a period of time we'll be able to move people from the acute care, well, we will move people from the acute care into long-term. We probably won't have enough beds available, and so we'll be building in conjunction with my partner from seniors, Minister Johnson, package of housing which might be either in the larger centres or in the rural areas to meet the needs of the communities, so that we are not leaving people in any part of the province shortchanged for the kind of long-term care that they need.
Fundamentally, the reason people are sitting in acute care is not because they need a majority of continuing care spaces. They need long-term care nursing beds. And putting the clients into continuing care beds, which is a lower level of care, will only force them back into hospital. They will return to hospital by ambulance and end up right back in the exact same acute care bed. By opening no long-term care nursing beds today, they clearly have no idea what Albertans are asking for. They obviously were very, very busy because they didn't even have the time to talk to Dr. Paul Parks, who has made this issue so very, very clear about the difference between long-term care and continuing care nursing beds. The minister today talked about rapid flow beds. Let's all remember, last year they closed those 30 same beds. Let's all remember that over the last 3 years they've closed multiple transition beds. Let's all remember that over the last 5 years the same government promised to open 1,000 continuing care beds every year for the last 5 years. That is why ASLI money is sitting on the table right now, because they didn't do their job.